So I'm Craig Peters, and I'm in the Division of Urology. So I'm a pediatric urologist, which means I deal with all the conditions related to kidneys, ureters, bladder, external genitalia for boys and girls up until young adulthood. And it's a wide range of conditions that we see. Certainly one of the most common is urinary wetting, and we see this at a variety of ages and can be more of a problem in some kids than others. And when we think about wetting, what we first try to ask is, what's the pattern? Is this a small amount of wetting that the child can resist and control but doesn't choose to? Is it associated with the urge to urinate or urge incontinence, where the child can sense it's coming but can't seem to control it? Is it wetting that the child is completely unaware of and that they're almost oblivious to it? And this is often the child who's waiting too long to go and has simply tuned out their bladders. Is it total incontinence, where the child is always dribbling and always wet? And once in a while we can also see stress incontinence. This is more common in older children and often very vigorous athletes, and really only girls, where they leak only with very active sports participation, occasionally with laughing. And finally, there's a very uncommon condition of wetting called giggle incontinence that literally is associated with people leaking urine when they laugh. And we don't understand it. It's a different kind of condition, but there are some treatments for that and management strategies. I think another important thing to think about with wetting is the fact that it's very often associated with constipation. And everybody has a little different definition of constipation, but fundamentally, most children should be having one soft, comfortable bowel movement a day. If it's hard and uncomfortable, that's not normal. And that is going to aggravate and sometimes be aggravated by wetting problems and can contribute to urinary infections. So improving diet, working with your pediatrician to get either medical management of constipation and enhanced diet often will correct this substantially. But we need to recognize that wetting and constipation and often urinary infections do go hand in hand.